All right, good morning, everybody. We'll get this started. First thing on the agenda is the agenda.
I'll move to approve the agenda as stated.
I'll second it.
All those in favor?
Aye.
Minutes of the January 14th meeting.
I'll make a motion to approve.
And I'll second.
All those in favor?
Aye.
Resolution 5-2025 utility values for 2024. Yeah, they're listed by entity, Burlington Northern Railroads, power companies.
I'll make a motion to approve.
And second.
All those in favor?
Aye.
Discussion on resolution to declare emergency medical services to be an essential service in Wapello County. Tim?
Okay, so last time I promised you to bring some information, and I have that for you today, and it's also in your print handout. I think it's important as we start this conversation to get a little historical context to understand for everybody that's not been involved in EMS, as long as some of us have, what we take for knowledge that's for granted. And I just will real quickly run you through the Wayback Machine and bring you to what created EMS today. So we'll start in 1940. In 1940, what patient care looked like pre-hospital was funeral homes provided transport if you needed to be transported to the hospital, if you didn't get there by other means like a private vehicle. You can see here an ad from a local funeral home. There used to be 4 funeral homes in Ottumwa that provided that service, and they would answer day or night, and they even provided oxygen, which was a big deal back then. But that's all you got. You got a flat transport and some oxygen. In 1942, they started a fundraising effort to fund a real ambulance. And now, keep in mind, an ambulance in those days looks like the Ghostbuster car. You know, it's the Cadillac, big Cadillac. And it went to the Defense Ambulance Fund, which was part of the Civil Defense Committee, which Civil Defense is the grandfather of my organization. And in those days, they were trying to raise $1,200. In today's money, it's about $24,000. Still a pretty cheap rig. In the 1950s, we start looking at having a little more formal ambulance service. In 1952, the Ottumwa Fire Department began a 24-hour ambulance service, and that ambulance was provided by public donations, and there was no fee for service. And a Courier article in 52 reported there were fewer fires that year, but the ambulance calls were busier. And you see there, they match pretty close. In 1953, there was conversation about we really need to upgrade this ambulance we have that isn't new. And the firemen really questioned the need to buy a new one because at that time they were laying off 4 firemen. And then the cost of that ambulance increased significantly to buy a new one to $7,800. And so they did discuss fundraising and using a subscription model. In 53, the money was made available from the city to purchase that ambulance and came from the Public Safety Fund and $1,200 in donations, and the whole subscription concept was not successful. In 55, unfortunately, the brand new ambulance was in a motor vehicle accident 1 month after it was purchased, and so they relied on private services while they replaced it. And ain't it a beauty? We don't have anything that classy today, do we? In the 1960s, city begins charging per trip to try and pay the bills, and the fee was $8. And 4 years later, it had to be increased to $12 per trip. The hospital handled the billing and the follow-up collection letters by the city clerk's office. 1966, for those of us in EMS, we know that as a pivotal year because that is when a report called the Accidental Death and Disability, the Neglected Disease of Modern Society, known as the EMS White Paper, was presented. And in that report, it showed that in 1965, more Americans were killed on American roadways than were lost in the Korean War. And that was a pretty controversial war of the time, and so that really got a lot of people's attention. And so that really started the national conversation of standardizing of emergency training, which led to the first nationally recognized curriculum of the EMTA, which is Emergency Medical Technician Ambulance, and many consider this document the birthplace of EMS. Locally in 67, the Ottumwa Fire Department discovers it's very expensive to run an ambulance service, and the chief at the time didn't want to run it anymore. And so the city was at max levy. They were really struggling to figure out how they were going to pay for it. 6 of the firemen on the crew, their salaries were attributed to that ambulance. And they're really fighting with the high pension costs because they've had to retire firemen out with back injuries. And we know when you get into EMS that's a #1 early career killer is a back injury. In 67, they talked about the legality of charging for ambulance service. That was controversial at the time. And the AG's opinion says a county hospital may subsidize a private funeral home to provide the ambulance service for the hospital, but could not subsidize the service to the hospital other than the county hospital. And our county hospital was a tuberculosis sanitarium. It was called Sunny Slope, and that was our legal county hospital. So they were the ones able to levy any sort of money. In 1967, there was an ambulance fee study that was done at the University of Iowa. It was actually in the Bureau of Police Science, studying the state of crisis and emergency ambulance service. Many towns and cities, police and fire were picking up the service because many funeral homes in Iowa were ceasing service due to new federal minimum wage for drivers. 70s was a really busy time for EMS. Notably in California, at the time was Governor Ronald Reagan, signed into law the Woodworth-Townsend Paramedic Act, and this law established conditions for the establishment of the first accredited paramedic training program. Many of us know about that because many of us watched as youth the TV show Emergency that aired in 1972. The pilot episode, which was a 2-hour pilot, that's what it was based on, was the training that was going on in 1969, and they weren't allowed to use it because the law hadn't passed. And in the 11th hour, Dr. Brackett, that was the medical director of the show, went to the legislature to push that law through. And that's what then authorized the LA County Fire Department's pilot paramedic program to actually do a program. And that show Emergency actually reflected what was going on in real life. And so as we as a country were taking that all in, that really began to shape our expectations of what this emergency service should be or what it should look like. In 73, locally, the funeral homes ceased to provide any ambulance service. There were 4 local nursing or funeral homes that were doing that, and they told the county supervisors they would cease that service December 31st at midnight, and they had been handling the transfers from nursing homes to the hospital. Later in 73, the EMS Systems Act of 1973 in the U.S. Congress established NHTSA under the DOT as a lead agency to develop EMS systems and provided funding for 300 systems nationwide. And so EMS was born and put under DOT because it was created to be a trauma system. And remember, the white paper talked about how we were killing so many people on American highways. We needed to get them transported to hospitals from those trauma situations. In 74, Ottumwa was kind of looking for a way to improve the ambulance service. They compared notes with a sister city, Marshalltown. And at that time, Ottumwa had 1 emergency unit based in the fire department and 2 non-emergency units based in the health department in the city. And no emergency service was provided to the surrounding communities or rural. In 74, an ambulance plan was revealed where the Ottumwa Fire Department would operate an emergency ambulance only and only in the city limits and the short sections of highway outside of town. If the fire department was busy, say on a fire, then the police department was ordered to respond with the ambulance. And then the city would no longer provide non-emergency service, but would give the ambulance a driver if they needed to, but the hospital had to provide the attending personnel. In that same year, there was fundraising efforts in Eldon for their ambulance service. And then in 1974, in June, the county takes over the ambulance service from the fire department. Wapello County Ambulance Service began its operations on June 24th, 1974. Prior to that date, only non-emergency transport service was provided by that service. The new service would respond to calls anywhere in the county, and the public used the 7-digit phone number. And there were 12 members at that time going through that EMTA training at the St. Joe Hospital where the base was. In August of 74, a new ambulance pact between the city and the county was formed, and under the agreement, the city would make its ambulance at Central Fire available for emergency service in the county, and the 3 city-county ambulances, if the 3 city-county ambulances were tied up, and discussions were underway with the surrounding towns for backup service, because there were ambulances out in some of the smaller towns. If the ambulance showed a loss, then the city-county would split that deficit. In 75, a new ambulance was desired, and they were really trying to purchase one of the Mayfair ambulances that were featured on the emergency show. And that never came to fruition, but they did raise some money that was geared toward what they considered a new technologically modern ambulance. So it's more of the square body type that we're used to today. They had struggled with ambulances breaking down and needed funds to replace those. Back in the 70s, they had a thing called a federal revenue sharing plan that the federal government would share funds to local entities, counties, and cities. And that is where a lot of the money came from for the subsidies we'll talk about. In 75, in July, the purchase of the new ambulance happened. The fundraiser was successful, and they purchased a new Dodge Maxi van, which was a big deal because we're now out of the Ghostbuster vehicles. In 78, they had a critical patient they were transporting to Iowa City. It broke down. Johnson County Ambulance had to come to their rescue. So they were looking at constant repairs, and this is a common theme as long as you own a fleet of ambulances. But new ambulances then increased in price from $20,000 to $24,000. The city and county contributed 1/4 each to the annual budget, which was $170,000 in fiscal year 78. The receipts were counted for the other half. In 79, the county supervisors discussed moving administrative jurisdiction of the city since they had most of the calls. And Ottumwa at that time had 26,000 of the then county's 40,000 people. And the costs were 50-50, but the supervisors questioned that cost share. 79, they were also losing money, and there was some disagreements between the city and the county about who should be hosting that service. And the ambulance service received a $75,000 from local subsidy. In the 80s, the headline of the Courier read, "The county wants out of the ambulance service." And the ambulance was offered to both the hospitals that we had at the time, Ottumwa Hospital and St. Joe Hospital. Ottumwa Hospital said they would consider either a joint ownership or just taking it over. And the hospital administrator at the time said they have a deep commitment to emergency services. The ambulance fee at that time in 1980 was $65 a run, and Medicare and Medicaid paid 80% of that. And the budget for that year in fiscal year 80 was $243,000, and only $100,000 come from patient fees. In 1980, we had a state representative, Gettings, that proposed a bill to allow counties that don't operate hospitals to do a 27-cent levy. Also in 80, St. Joe Hospital proposes that hospitals, doctors' offices, and nursing homes pay a fee to support the ambulance. Ottumwa Hospital had proposed building a facility on their grounds to utilize the crew in the hospital when not on runs and reimburse the county for that time. And the fiscal year 81 budget was $304,800, with the city and county each contributing $90,000, which still left them a small deficit. In 80, ambulance funding was still a problem. City and county contributions increased from $48,000 to $90,000. And at that time, Parks Commissioner Jerry Parker said that they would have to lay off 3 positions from police or fire or not fill retirements. In 80, the article reads, "Ambulance attendants get sophisticated training," and this is kind of a hallmark because there then were become different levels of training in Iowa, from EMTs to EMT 1, it was called then, to paramedic. Prior to that, they were just EMTAs. Ambulance calls were averaging 8 per day, and 80% of the calls involved the elderly with heart or respiratory ailments, and others were falls. There's some discussion about the cost to convert service from a basic EMT service, which they had known to date, to a paramedic service, and that would cost about $20,000 for additional equipment and supplies, not including the ambulance. In 1980, the legislation did pass that Gettings was pushing, and it took effect January 81, that allowed counties to vote an EMS levy for 27 cents per thousand. In 1980, in September, a new ambulance tax levy question was discussed, and the new tax could generate $96,000. And the county had been relying on federal revenue sharing funds to support that to that time. So the supervisors placed the tax levy on the November ballot. The ambulance levy failed at the polls by 119 votes, but also on that same ballot was a hotel motel tax. And so that's just, we now know you don't put 2 of those referendums on the same ballot. In November, the ambulance fate may be up to Congress was the headline. The U.S. Congress is deciding if they will continue that federal revenue sharing program. At that time, the county received $341,000 from the program, and $90,000 of that is what they used to subsidize ambulance service. In 80, the ambulance staffing, the ambulance service lost their EMT 1 designation and lost some capability, and because there were some EMTs fired for misconduct. Late that year in December, St. Joe Hospital and Ottumwa Hospital worked out a plan to move the ambulance management to Ottumwa Hospital. Sort of related to the ambulance, 1981, Jim Ragland, who was a finance person in St. Joe Hospital, pursued setting up a city 911 phone number because prior to that, 911 did not exist. And the phone company said they had the equipment, but it cost $7,000 and $9,000, and the system would cost the city an extra $150 a month. So the city agreed to put the equipment in the city hall, and in exchange, the hospital waived the rental fee for the bay for the ambulance. And then the hospital also paid for the installation of the new equipment. And so 911 became present in the city of Ottumwa. In 1981, the county surrenders the ownership right and authority of the city so that the city can singularly negotiate with the hospital to take over. And in April of 81, the county was officially out of the ambulance business and gave blessing to Ottumwa's hospital's plan to provide the ambulance service beginning July 1st of 1981. It ended a 7-year agreement that was between the county and the city, and the county sold their assets for $1. And they agreed to continue to pay half the cost of the 3 new ambulances to get the new service started up. That new agreement came with a 3-year contract with the hospital, and that contract basically provided subsidy funding so they could buy equipment was the largest need. Ottumwa Hospital's offer also included upgrading the service to a paramedic level. So it'll be the first time we had paramedics in our system. The contract brought some concerns about how the hospital is going to use some money, and the hospital asked that the contract be amended to say they could use it on ambulances and the equipment to go in the ambulances. And then July 1, the service officially began with a public subsidy of $152,000. They could cease the operations with 6-month notice, but as we know, that never happened. By the end of 1981, the service had 11 full-time paramedics and 5 EMTs. In 1981, the ambulance service cross-trains with the Ottumwa Fire Department, and Ottumwa Fire Department showed the medics how to operate on fire scenes and what fire equipment was like, and then in turn, the medics showed the firemen how to use the medical equipment. In 84, it's the end of the 3-year contract. Ormix makes a request to the city and county to continue the subsidies and asks for $33,250 each, and basically this again is for equipment and replacing of ambulances. Later in 84, the hospital proposes subsidies continue through 88, and that would be $79,000 at that time in 88. The average Ormix bill that time period was $136, with a basic rate of $85 in town plus $3 a mile one way, and an extra fee for supplies and the cardiac monitor. 1987, there's a Courier article that the headline was Southern Iowa counties having a hard time funding ambulance service. They talked about basically all our neighboring counties' ambulance services, so everybody was struggling in those days. 1989, the Sunny Slope Care Center, which was our legal county hospital, closed and then ceased our ability to levy any sort of extra EMS money through that facility. Also in 1987, the federal revenue sharing ended, and that's where the large share of the subsidy money came from. So the 90s was kind of a good period, actually. There was not a lot of controversy. We had a lot of first responder agencies starting up, and the hospital was the mothership for those agencies, and help with those creation, help with training, and got a lot of people involved in EMS. In the 2000s, Ormix did not receive any subsidy or any funding from county tax levies, and so they started a new tradition called the duck race, and that was to provide funding for a new ambulance. At that time, an ambulance cost $86,000. In 2002, the Ottumwa Fire Department started raising money to buy defibrillators and other equipment to be compatible with Ormix. And they had 20 people involved in training to become medical first responders and to assist with the ambulance calls. They started the Ottumwa Fire Medical First Responders Program. Their focus was on the south side of Ottumwa, since the ambulance was so far away from that side of town. 2003, the EMS Association, there was an article about what we do in the association with training opportunities to push for emergency medical dispatch, and working on a community trauma education program. And we were just trying to get more people involved in EMS and get the community more involved. And in 2003, there were same conversations been going on. Blakesburg's ambulance was needing some funding. In 2010, we saw the state of Iowa develop what's called the EMS System Standards document, which provided a scoring rubric for us for our EMS systems. And we never really had a yardstick like that before. And so in 2012, the EMS Association conducted a public meeting of all of our stakeholders to do our first system standard assessment and review this new rubric with the public. In 2019, the Public Health Department decertifies Medicare and Medicaid, no longer provides in-home services, and that later becomes kind of a feeder to some of our EMS volume issues. Of course, you know, in recent history, the 2020 worldwide pandemic and the Great Resignation kind of coincided, and both of those dramatically affected our workforces across all sectors, and healthcare was especially hit hard. 2022, we revisit the system standards, become a new push again at the state level after a revision in 2017, and that information is now provided annually to the Service Area 5 Healthcare Coalition, as there's healthcare coalitions throughout the state that is a partnering of public health, hospitals, and EMS, and that information flows up to the Iowa Department of Health and Human Services. And basically that just lets us report local kind of status to the state, so the state kind of get a general idea of where things are with systems, so they can make those report to legislatures. In 2022, Tacoma Regional asked local officials for financial assistance to shore up services. They were really feeling the hit from the pandemic and the staffing issues that we were seeing in the healthcare sector. And those conversations were ongoing in 22, 23, and even today. And so that's what leads us to today. We first talked about essential service in July of 23. Other priorities came up. And then this January, to start the new year, Supervisor Ziegler said we need to revisit this conversation. So we began work again on essential service. So what does our public ask of us locally for EMS today? This graph shows you the last 5 years of data. And this is all the data from Ormix, because they respond to all the medical calls throughout the county. And you'll see it's a pretty level line for the most part, between 4,700 and 5,000 calls annually. And you see on the bottom line how many of those are transfers to another facility. There was a bit of a drop in 22 and 23 because that's when we really had a lot of staffing issues, and I'll talk about what was done about that here in a minute. 911 calls versus transfer calls. So 911 is important to get that critical patient to the hospital, but we know that 70-80% of calls really require basic level care, and only 20-30% require paramedic. Problem is you never know when those calls come. So you have to be in a constant state of readiness for that resource all the time. Transfer calls sometimes take away from staffing, but they're still a very important part of the equation because they're still our patients. They're still our family members, they're still our neighbors that need to go on to definitive care, and every hospital in a community of our size or a hospital of our type has to transfer care for certain acuities to higher level hospitals. So here's a little snapshot of 2024, and here's the types of calls that the public asks us to help them with. You see 64% of that is a medical type of call in nature, 20% of that is a trauma case, 12% of those are transfers to other facilities, and we have 2% that's a lift assist. So the workforce challenges has been something we've all had to wrestle with the last few years. The COVID pandemic really changed the way we work. It changed the people available to work. We saw that with the Great Resignation. It really exacerbated a mass retirement by the baby boomer generation that we knew was going to happen. But I don't think any of us anticipated it happening as rapidly as it did, and the pandemic was a lot to blame for that. EMS has really suffered because of those two things. Plus, we have a new generation of millennials that really love tech jobs, and it's harder to recruit those kids to some of those more hands-on jobs, if you will, or technical trades. The other problem we faced at the time was pay for EMS providers was very low compared to other opportunities and even other EMS services. So we had those conversations with the hospital. Some of those were very pointed conversations with local stakeholders. And so what was done with that? Well, we decided to tackle some of those things head on and tried a couple different things that seemed to be working well. 2 years ago, we started a 4-county project, which created a summer youth EMT internship. We launched that in my office and then handed that off to the college that did another successful program last year. And that really is kind of tagging on to some other very successful internship programs that are going on in schools with other types of things like technical trades, welding and construction, those kinds of things. we've learned that if you don't get to kids when they're juniors and seniors, we probably will lose the opportunity because they have so many great opportunities for concurrent enrollment. To also address the staffing shortages, Tacoma Regional increased pay for their EMS staff twice and got them up to a competitive wage in the market. They also offer a sign-on bonus to new recruits. And then they're working on partnerships with Indian Hills on several different health programs, EMS being one of them. So what does the law actually require us to do for EMS? The short answer is nothing. Most people are not aware that EMS as a service, as a public service, is absolutely not required by Iowa code like fire service and police service. The township code states that the township may provide that service, but that money's coming out of the fire levy. And we know that the fire levy is not adequate because that funding hasn't changed since the 70s and 80s. So the new Iowa code that was passed in recent years, 422D that we talked about here, was passed to allow counties to declare EMS an essential service, to make it a local requirement, and allow us to study our issue, figure out what solutions might look like, and ask our voters for funding. We talked a little bit about the standards for EMS, and that's that EMS system standards. There was an update in 2017. That's something we take a look at annually as an EMS association, which is a association of services that meets and talks about best practices, way to improve our services. We manage grant funding for training and that sort of thing. It's a peer group that really has no authority. So it's a little bit different than what the advisory council is in EMS Central Service for the supervisors. So how do we meet the standard? How do we meet the demands of the community? The first step is to declare EMS as an essential service and declare that that is a service we want to guarantee to the public. And this resolution we're discussing today is what does that. It's the mechanism that establishes a formal advisory council that is the advisory arm to the board. They will study the needs and develop a comprehensive system, recommend a structure and associated costs of what that will look like back to the board. And then at that time determine, do we need to ask the voters for money, or is there a way to do this some other way? And the task of the advisory council could be whatever you set forth as the board. So initially it's going to be a research arm, but they could have ongoing duties depending on how the system takes shape. So why are we doing this process? Well, we need to build a countywide EMS system that serves the needs of all residents in Walpo County in a sustainable, reliable structure. We have to be very careful and cognizant of what we do and when we do it, because one change in a municipality affects everybody else, and there's limited resources that we all share. And so we have to be very intentional about how we develop those services, what they look like, and how we support them. This was the timeline I shared with you last time on the resolution. And the next step would be today for a motion and a vote to direct the 60-day notice be published that tells the public the resolution will be considered for its first reading at their April 8th meeting, and that publication also includes the resolution.
Out of breath?
Yes.
All right. Any other comment? All these people, nobody's got nothing to say. So we need a motion to proceed forward then.
I'm going to make the motion.
And I'll second.
All those in favor?
Aye.
So get the 60-day notice published on the 1st. And 8th, we'll go with the first reading. All right.
Could I
Comment?
comment anyway?
I just asked for a comment. You did not comment.
I wanted to do it at this point.
Oh.
Thank you. I appreciate everybody that is here that in regards to this topic. Thanks for your attendance. Maybe you didn't speak, but your presence spoke. So thank you. And we look forward to working with everybody in the room that represents this category. So this is a good time to share and speak up and participate in making this work for all of us. It's a neat opportunity. Thank you.
All right, next on the agenda is request from First Presbyterian Church for $5,000 donation for food boxes.
I'll make the motion.
And I'll second.
So you didn't have to stand up and talk, did you? Cost advisory services for fiscal year 2024 from DHS. We had to have a long discussion with our auditor about this, so she's going to explain it.
Basically, it's an audit that they do over the DHS system. They do an audit to make sure all the costs for the communications, they get what the communications spends on those cases, and they do the audit of what the DHS says so that you can get federal funding back. And then after $39,000.
It comes quarterly, right?
And Kelly, this is a standard that we've done in the past, correct? So it's not new.
No.
Okay. I'll move to approve.
I'll second.
All those in favor?
Aye.
All right, liquor license for Elliott Oil, Highway 63 South BP.
I'll make a motion.
Second.
All those in favor?
Aye.
Aye.
Resolution 1-2025, abate property taxes for City of Ottumwa.
Is there anybody here that represents that? I don't think so. So let's.
No, this is the standard one by the Iowa Section Code 445.63. So
I'll move to accept.
I'll second.
those in favor?
Aye.
Guardian RFID agreement, Sheriff's Office. Don?
So this is an agreement that we've been working on here with the company to move from a basic paper system to a electronic system that head counts, movement of inmates. Here in the next couple months, we're going to have an interface with it so we can medication disbursements. They don't keep track of all this information. Also, when we do head counts and make throughout the building, there's plaques on throughout the facility that allows them to scan it to make sure that they're making those trips through the building. It just kind of provides that security that they can be down top. This is all electronic that interfaces with our systems where our data has, and it's, we have the money we budgeted before this in there, so it's in the budget. So that agreement.
I'll make a motion to approve.
And I'll second.
And I would tell you it'd be a good thing because some of the occurrences we've had in the jail in the last couple of years, it'd be good to have that monitoring. So we have to take Fuller's word for it. Okay. All those in favor?
Aye.
All right, personnel. Request for payroll approval, change of employment, deputy auditor.
I'll make a motion to approve.
And second.
I was wondering, we had a employee retire and we're promoting one to her position for payroll. So all those in favor?
Aye.
Request for payroll approval, new hire correctional officer.
I'll make a motion to approve.
And second.
All those in favor?
Aye.
Request payroll for approval of new hire deputy sheriff.
Female law enforcement officer in Oskaloosa. We'll have a contact for
Buying her contract out.
I'm working with the chief trying to buy the best. Can't pass the best on the
Nope, they're fitted for the person.
that's she really would
I'll make a motion to approve.
And second.
All those in favor?
Aye.
All right. Any other business?
Jared?
Good morning, guys. Jared Hirschberger with Dusty Foxwind. I don't really have anything for you guys today, but I just wanted to stop and say hi. And Mr. Batterson, I know we talked about potential meeting on the 3rd, 4th, or 5th. Did you have any thoughts on that?
Yeah. These guys filled up my schedule, so we're going to have to find a day that week that'll work.
Still that week?
Hopefully. It'll probably be just me and you.
Okay, I'd like to get our developer here as well, and he'll be coming in from Charlottesville.
Okay. I'll just start with you and then we'll go over that. So,
Okay. All right. Thank you.
all right. We have our reports. Second quarter fees collected by the sheriff's office.
I'll make a motion to approve.
And second.
All those in favor?
Aye.
Anything else? Appreciate everybody's attendance. It's nice to see a full room. Motion to adjourn.
I'll make it.
I'll second.
All those in favor?
Aye.
Aye.
All right. Now we're going to enter into a work session with Masco County.
Absolutely.
And it's over placement of 911 on the tower, correct? Yep.